I'd like to invite Lynn Stevenson to the stage. So Lynn is the Associate Deputy Minister of Health for the province of British Columbia. She is responsible for the healthcare portfolio for our province, and her divisions that she oversees are primary and community care and policy, population and public health, health sector workforce, partnerships and innovation, hospital, diagnostic, and clinical services. She comes to this from a registered nursing background, and she's worked in senior leadership roles at Fraser Health, Island Health, and the Cancer Agency. And today, we've asked her to just share some thoughts and impressions based on being here for the day. First of all, thank you for being here for the day.
You're very welcome. Thank you for inviting me for the day.
You know, I say this because so often senior leaders come and start the day, and then they're busy doing senior leader stuff. And I would say that this is senior leader stuff. So thank you for taking the time and making it a priority. Let's go back to the beginning of the day. You were sitting at the table just here, listening to Michelle and Jacqueline. What were you thinking about as you listened to the two of them talk about relationships in healthcare?
So I thought it was a perfect way to start the day, because if we don't start with what is the point in the first place, which is the patients, their clients, their residents, you don't have a level set about why we want to be stronger teams, why we want to improve things. And I think Michelle did a superb job as we moved on through the day, looking at the values, this whole notion of respect. I mean, I don't know, because you guys were counting the cards, it came up at every single solitary table. So I thank you, Michelle, because you set the groundwork of how should we as teams be working, and that fundamental piece. And then who knew David had a diagram where the bottom said respect? So isn't that just, and trust? So it was wonderful to see that actually start. I think the other thing that Michelle set the stage for is how teams should work together. So she talked about her relationship with her care team and with her physician and that one-on-one. I guess one of the things I'd like to put out there, and thank you all for inviting a Ministry of Health team, because I looked at what Michelle was saying, and that should actually apply to all of us, because if we're not in respectful relationships with each other, and I know that occasionally people say things about the Ministry of Health. I know none of you people in this room say anything about the Ministry of Health, but I've heard on occasion, and when I worked in the health sector, I might have been known to have said a few things. And not very often. But I do think we have an opportunity here to fulfill what I think Michelle put out to us as the challenge. The more we work in relationship and the more we work as a team, because believe it or not, we're kind of on the same side. I think you said, Michelle, everybody puts their pants on one leg at a time. I remember when I put my pants on one leg at a time, the Frasers, and it's not that much difference now that I'm part of the Ministry of Health. So I just think it was a wonderful way to start the day and remind us that we're actually, no matter our positions or our jobs, we all signed up for the same thing, which was to improve care.
So we come together and sit in a room to talk about ethics, to talk about creating patient-centered care, including families in the conversation, making it more about relationships. And then we go back to our busy lives at work. How do you help people square that circle and take the big thinking and feeling of a day like today and actually turn it into practice across the system in British Columbia?
So again, I'd like to actually have Michelle come and work for us, because I think what you have to do is continuously do what you said. So we work in the policy framework. So we do policy. We write stuff, and you guys are all going to roll your eyes and say, yeah, and we don't know why you do that, because it's a little bit odd at times. But we think, actually, we're thinking about patients. But I think what we need to do more of, I think, Catherine, is be explicit and deliberate about it. And I think, I can't remember whether it was David or one of the folks that talked about explicitness and deliberateness. So one of the things that we are trying very hard to do, keeping in mind, you see people and patients every minute of every day, we don't. We work in a government building, we're kind of government people, trying to remind ourselves that every minute of every day, you're doing this for a purpose. And I think that's the challenge we have. And it's, I would say, challenging to lots of the folks that work in government, particularly the ministry. They don't have the context that you have. So they actually find it difficult perhaps to relate to what Michelle was talking about. But her basic values that she pointed out, I think we can all align with.
Can I put you on the spot?
No.
I'm not going to ask you about the provincial election, but I am going to ask you. Lynn left our table and went to work with her team from the ministry. And I'm wondering what you learned in working with your team this morning.
Well, I think what we always learn when we're working with each other is that we're much more the same than we think we are. And again, it's always very amusing to me when I dance on both sides of the health sector that we actually are the same people, we have the same goals. Our roles are a little bit different, but again, it goes back to Catherine, something I said, the more we can understand each other, the more actually I think we could move things forward in a much quicker manner. So, but all of the values that we've talked about, even the case study this afternoon, was very similar. I mean, we don't typically deal with clinical issues as much, but it's the same process. So we found it very valuable, actually.
One of the PowerPoints that went by earlier mentioned this move by the provincial government toward making sure that there was care and attention paid to the well-being of the people in the healthcare sector, not just the patients. How do you do that across the system? Or can you do it across the system?
So good question. No, I can't. I think, however, one of the opportunities when you work at the ministry is setting some expectations. So that's a fairly, I mean, David mentioned this morning, that was a very deliberate statement that said providers and patients, because that was a very deliberate recognition. And I think, again, I think it was David, hurt people hurt people. So the whole notion that we wouldn't look after ourselves or look after our care providers or look after our team members and yet think we can actually deliver high quality care. I guess for me personally, that just doesn't round it out. And the example we were chatting at the table, if you're on an airplane and the oxygen thing comes back, you actually always put the mask on yourself first and then your child. So we went through this with H1N1. It's, if you don't look after yourself, you can't look after patients. And again, back to Michelle, those basic values I think apply.
One of the things that we've been working on throughout the day today, and it comes up year after year at this conference, is this idea of being open, humility, being open to learning and being curious. In leadership roles, sometimes that's a bit of a dissonance. Leaders are supposed to be strong and decisive, and they're not supposed to show vulnerability or weakness. How do you, as a leader in healthcare, make it okay for other leaders in healthcare to say, hey, you know what, I haven't got an answer here?
I think, again, picking up on one of the things somebody said this morning, this whole notion that you make mistakes. So I think you make mistakes. And is there anybody in this room who hasn't made a mistake? And whether it's a clinical mistake or it's a mistake in judgment. We were talking, Michelle and I, about the mistake we made with patients as partners as in the Ministry of Health. I think, one, you have to recognize you're going to make mistakes. And that's okay. I guess I've never seen a leader that's a real leader that hasn't actually had some colossal badnesses happen.
Can you talk to them about that, though, and say, hey, it's okay for you not to walk in here and be in charge?
Well, I think we're very hierarchical in the ministry. So for me to say, it's okay for you not to come in here and be in charge, I'd say you're right, because you are. I mean, so I think we need to be a bit careful about that. I think you model that. You model actually making mistakes. You model actually saying, and I'm sorry. You model saying, whoops, you know, because I think it's the absence of malice. Nobody actually says to themselves, I think I'll make a big mistake today and see if we can't actually wreck stuff for people. I mean, none of us do that. I mean, I know you think we do that when we send you policies out sometimes, but we really don't sit in the closet and say, I know what will make these people's life miserable. So so I think you model that, Catherine. I don't think you can say to people, and you have my permission to make a mistake, because it's not very sincere. I think you have to be vulnerable and you have to be humble. Like I said, sitting beside Michelle, and I said, oh gosh, we've met, when was it? And she told me, oh yeah, I remember that. Not a good time, but you get over it, you apologize, and you move on. And I think one of the things that we talked about just the other day at the ministry is one of the good things that healthcare has done in the last 5 or 10 years, this notion of just culture. And we aren't there yet in government. We don't have a just culture. We still have a fairly closed way of looking at mistakes.
The idea of evolution and change and paying attention to relationship is great when you have a day to do that and we're all together and we're away from our day jobs. But all of the people in this room are up against it. They're short-staffed, they are up against time constraints, they're being measured against efficiencies and expectations, and somebody's keeping track of every minute of every day. How do you ensure that some minutes in every day, the people in this room and the people beyond have time to make the change that you're asking for?
So, and this like it won't be a popular comment, but I'll make it anyhow. I think you make the time. So back to, so why am I here? I'm occasionally a busy person. I've got other things I could and should and might be doing. And again, I think you model taking the time. I'm always curious that, you know, you go from hospital to hospital or community to community, and some communities or offices seem to be able to take the time and others don't. And we could all argue whether it's a workload issue or it's a value issue. You will make time for what you think is important. And I guess I do believe there's the time. I know we get into this narrative of we're busy every second of every day. We don't go to the bathroom. Nobody eats lunch. We never sleep. I don't buy it, Catherine, not 365 days of the year. So I think as teams, and I think part of the purpose of today was what do you as a team do to actually carve out some time? And it doesn't need to be hours and days.
What will the system look like when you know that it's doing what it's meant to be doing, and it is just in serving British Columbians in the way that you think it should be?
I think when we spend more time thinking about what Michelle was trying to teach us this morning than thinking about ourselves, I think we have to care for ourselves, but I think it has to be grounded in what we all signed up for. Those of us that are in the healthcare, we signed up to actually improve things for people. And so getting back to that roots, I mean, whenever I'm thinking about some of those case studies, people just don't naturally become not nice people. There's something that's gone on. So yeah, I think continue to reminding what we all signed up for in the first place.
What do you think you're going to do differently tomorrow as a result of today? I'm asking you this because we're going to ask everyone this question at the end of the day. We're going to ask them to choose a thing and go back and make a change. What are you going to do?
So I think it would be fair to say we've got some work to do in the ministry around this whole notion of team and values, and we have, like I would imagine in the health authority, we've got pockets of brilliance, and then we have not so hot. And I think we need to have a more, again, deliberate, concerted effort of what do we want the entire culture to look like. And I think, yeah, so I think we've got work to do. So for us, being here today, this gave us an enormous opportunity to see some ways that actually you could see yourself clear around that, and actually have us a bit more engaged with why we come to work every day. Because it's hard, you can lose track of that quite easily.
Okay, so that's high level, but about you tomorrow?
Well, I'll make more mistakes and tell people about them. I guess, Catherine, I think I'm fairly grounded about why we come to work. So I think one of the things that I would do more of, or try to do more of, is be that translator, because I kind of get government now, and I completely get the health sector. So trying to actually build those relationships, because when you have those relationships, it's remarkable how fast things can happen. And we've had some brilliant examples. If you look at the opioid crisis, it should have been impossible to do what's been done. And yet through relationships we have, because everybody had a common purpose.
But not enough and not fast enough.
Depends on your perspective, doesn't it?
Apparently. Okay, thank you so much.
Oh, you're welcome.
Thank you. Thank you to Lynn Stevenson.